Now, it's a very interesting thing about all connective tissues, because the cell has only the function of elaborating materials which are then calcified or hardened to different degrees. A cell that is growing needs protection. The word pleomorphism, it means that it takes several shapes in its formation. Like a caterpillar will become a cocoon, and then the cocoon becomes the butterfly. And who would think that a butterfly was once a worm? So some cells have no resemblance to what they're going to end up being. Now, there is such a word as epigenesis. The theory of epigenesis is that once a cell reaches a certain stage, it can't return to its previous state. Okay. Now, some work has been done by Becker in which this process in the cell has been reversed. I was taught that it was an impossibility, but he's been able to take salamanders and amputate their forelegs, and with electrical currents develop new cells to grow the limb again. So there's some wild research undergoing right now, attempting to regrow fingers, regrow limbs. So I would put one in here that's not here. These are not only, this epigenesis control is not only provided by the hormones, the enzymes, and the immune system, but also by the electrical system. This book is back there by Darcy Thompson, and it's On Growth and Form, written in 1920. We're going to be talking about morphology. The idea is to study deformation, and he talks about the Cartesian coordinates. This is a gnomon. A gnomon is a change in size without a change in shape. But for the most part, we don't grow in straight lines. We grow in curves. And so he talked about the helix and the radius of a curvature, which continuously increases. So we see many such spirals in nature. And if you notice here, this is a logarithmic spiral. And here's how we all started. We were pretty much a spiral in the beginning. So all through our bodies, we have these principles at work. And we'll be talking later about the golden section and the divine proportion. If we take the jaws at birth and consider the proportion of that to the adult size, we're already about 35% of our adult size by the time we're born. Now, in only 3 months, we have grown another 15%. The baby eats, goes to sleep, and grows. Then it goes back to sleep. So we grow when we sleep. Any good doctor will take a sick patient, put them to bed, and get them to sleep. This is where growth and repair and curing and healing takes place. In fact, when we wear headgears, we insist that they only wear it at night. That is when somatotropic hormone, STH, is produced by the pituitary gland when the growth is taking place. Look, in the first 3 months, he's growing 5% a month. So if we had any teeth in his mouth, when would be the ideal time to treat him? At birth. What is the youngest patient I've ever had? 2 weeks. Honestly. I had a very dear friend and her husband who couldn't have their own children, and so they adopted a child. And when they brought him home, he was micrognathic, mid-face that was way out here. A really grotesque-looking baby. They wanted to know if there's anything I could do. I knew all this. So I said, I have never done it, but I would like to try. So I took an impression of his face, and I made something that fit his cheeks here, making sure that I wouldn't close off his airway. I put pressure right through here with a small rubber band. He had a nice profile by the age of 3 months. So that's my youngest patient. So here we are now by the age of 3 years. He's already 70% by the time he gets all of his deciduous teeth and the roots fully formed at 3 years. So by 3 years he's grown another 35%. I've treated cleft palate children at the age of 2, but I've never treated anything younger than 3 other than a crossbite. If I had my choice, I'd want to see all my children by the age of 5. So I can correct the crossbites, I can correct class 2s, I can correct class 3s at 5 years of age. And the objective is to put the deciduous molars into class 1 and get the jaws harmonized so that when the permanent incisors, first permanent molars, come in at age 6, they come into a normal class 1 position. That's the way I've treated all my life. How long does it take you to treat a crossbite with a quad helix? 3 months.
3ヶ月ぐらいでしょうか。
So you treat it in 3 months, over-treat it a little bit, and hold it for 3 months. You got 6 months of treatment, and you've saved an asymmetrical face maybe. Class 3s, right and left, we got them wearing reverse headgears at age 5, bringing the whole mid-face out. So they'll develop a normal incisive overbite, normal class 1 molar. You don't have as many class 2s as we have.
まあ日本にはあまり2級はいないかもしれないけど。
But the same thing, put a headgear on the second deciduous molars. Widen it,
ちょっ
push
と
it
広げ
back.
てやって後ろに押してやって。
First molars come in class 1.
それ
What's the big deal? If it's my kid, I want it done then.
やってもらうそのようにしてもらい
So
たい
that's
し。
been my philosophy. It's based on growth here.
でそういうやり方。
Orthopedic change. I use these reference years, 3, 8, 13, and 18. First of all, they're 5-year intervals. Secondly, by this time, the deciduous teeth should be fully developed. By 8 years, the mixed dentition should be developed. But even at 8 years, you've got 80% of the growth. And if it's a female, it's more than 80. It's about 85%. Now, by age 13, the 12-year molars should be either in or about to come in. And in a male at 13, he's 90% grown. And he grows until 19. Actually 19 instead of 18 in a male. Females we find have a cutoff at 14.8 years. So we've only got, even at best, in most practices, 30% of the growth to work with. Now these are based on general height and girth in children's growth. Height and weight. Girth means your waist size. That's girth. Now here are girls. Here they are at 3.
3歳の時はここです。4
5,
歳。
6, 7, 8,
1年おきに
9,
書いてあります。
10, 11,
11歳でしょうか。10歳半ぐらい。
Boom. 11 and a half.
11歳半から下がります。
And we find here at 14 and a half, 14.8, and we're talking about now the growth of the head, the growth of the mandible. It's
ここ
over.
です。ここでもう終わってしまいます。
For anything significant, it's over right there. Now, this is general somatic growth. And here's males. So he's up here at 3.
3歳から始まります。
He keeps going, going, going. Then he drops off a little bit.
ちょっとここで成長が落ち
But look,
ます
only
が。
about 6 months.
でも6ヶ月ぐらいですね。成長が少し止まったって。
Then he has this long ride.
それから
It's a short ride here in the girl. We find that in order to forecast, we have to use a cutoff at age 19. But his body size is generally over about 16 and a half. First of all, if you want to enjoy a long, natural, good growth before age 7,
これは7歳。
it starts to drop down a little bit in the male after age 7. But look through here in the male. All except this little time right here, he's just as good here as he was there. Now again, let me remind you that this is the growth of the whole body in height. What animal is this? Rhinoceros. What animal is that? This was taken in Serengeti in Africa. I got close-ups of this, and I want to call your attention to the stress lines. It's a human.
これは人なんです。
It's Australopithecus.
オーストラロピテカスという原始人とい
It's
うか
2 million
昔の
years
人。
old. This is a specimen that Ardre wrote the whole African Genesis on. I went through all of Africa, and I ended up in Johannesburg. And Dr. Tobias was preceded me on the program, and he asked me to come out and lecture to his graduate students. Okay, if you'll let me see the early fossils. All right. Now we talk about early embryonic and fetal growth. 5 days after what do you call it? After fertilization, the egg travels down the tube and it reaches the morular stage before it ever implants. So the embryo has grown to this stage before it ever goes in the uterus. Enzymes and so forth, these cells break down and it implants in the wall of the uterus. A yolk sac is forming. And the embryo then lives on this yolk. And here's the little amniotic cavity. We're about 3.5 weeks old now. The woman even doesn't know she's pregnant yet. Now at about this age, 25, 3 weeks,
3週間ぐらい
25 days, we already see the mandible developing. The mandibular arch is already here. And look, the mandible is sitting right on the heart. Now here we are, an embryo
これが胎児です。
at this age.
この25日のところです。
Now at this time, the mandible is forming around Meckel's cartilage. So we're about a month old now. Now at 2 months, the embryo is no longer an embryo. It's a fetus.
もうすでに胎児になっていま
Yeah.
す。
So the temporomandibular joint, however, isn't formed yet. This is a muscle going up to this area. This is the future fovea. This is the future condyle.
でこれが将来コンダイルになる。
There's a muscle attached to it, but it isn't formed yet. So we come up now to 10 weeks, and we still don't have a joint developed.
10週
We
で
have the mandible developing, and we have the maxilla developing.
科学
But
上
look at how big the bones of the mandible are,
ください。
bigger than the arm. So now we go on to the 12th week.
次に
The palate is formed,
口外が形成されています。
the tongue has descended,
舌が降りてきました。
and now we begin to see a ridge developing in between the condyle and the squamous of the temporal bone.
でここで
Look at the amount of cartilage that's here.
これ
And
で
look at this prechondrogenic zone here. So here in a sort of a rundown
これもう
is implantation by a week, the branchial arches in the mandible forming at 3 weeks,
3週間
but still the embryo is the size of a pea.
でもま
The
だ
eyes become distinct at 5 weeks,
で5週
the limbs start to grow
そして
and are paddle shaped by 7 weeks,
形態になります。
and by 2 months or 8 weeks it's recognizable in a human form, and it's 2.5 to 3 millimeters long, which is only that big.
でも
Now we're no longer an embryo.
No.
Everything after that is growth.
これ以降は全部もう成長あるのみな
So
んで
it's
すけど
now legally a fetus.
でもうここから合法的に
Now
胎
the
児にな
fetal
ります。
stage.
で胎児期
At 9 weeks, look how fast it's grown. It's grown another centimeter in 1 week.
こんな
Now, you can identify the sex by the 3rd month,
で3ヶ月
and it's between the 12th and the 14th week that the joint starts to develop.
で
By 5 months, it's already suckling. So here now is the development of the human temporomandibular joint, and here is then the disc forming
でここで円盤が形成されていま
at
す。
14 weeks. So it's late in forming. So function develops this joint.
形成
So here we are at 5 months,
5ヶ月
and here's now the joint.
関
And
節
look at all this cartilage in this mandibular condyle.
この
All of us were pretty nasty. What does the baby do the minute that he's born?
で
He wants a nurse. Look, here's the upper jaw, here's the lower jaw,
上顎と下顎です。
and here's an x-ray of a baby nursing.
でこれ
This is the mother's breast.
これが母親の乳房です。
So I had a mother that agreed to do this.
こ
So I
れ写真撮ってくれて許
I
可を
wanted
求
to
めま
see
し
how
て
deep the nipple was in the mouth. But the interesting thing, the baby was asleep here.
でここでは
Look how far the condyle is away from the joint.
コンダイルがこんなに関節から離れています。
And here he is asleep at rest.
これは安静です。寝てます。
You see a preparation of the skull when you get a newborn skull, and these ridges are glued together for safekeeping.
になります。
Now at birth, all of these teeth have enough space to erupt simultaneously. They could all erupt at once if they wanted to. And of course, some of them get deformed
でもちろんこの奇形児もいます。
because of the failure of closure here and the failure of invagination of mesoderm. So we have
メゾダーム
all of these
が
kind of
回復しな
deformities.
かったからです。そしてこのようなさまざまな症状が出てきます。
And these are congenital problems.
しています。
We have diseases or conditions that we're born with. Okay, now these are general principles of growth that I've been giving. Let's look at the original growth concepts then.
それでは
The early investigators in growth measured from porion.
ポリオ
And they measured from porion in the frontal as well. Some of them cut skulls in two.
で人
And
に
so nasion was a point that was used, and so was basion.
その
In
場合
fact, Huxley called this the basicranial axis. I don't know how he got this line except from basion down to nathion. And here he's looking at the plane of the maxilla back to opistheon. But most all of the work up to nasion orbitale, prostheon infradentale. Prostheon is the alveolar process between the two upper centrals, and infradentale is between the lower centrals. So you see nathion and gonion and nasion and orbitale were all there in anthropology, and we simply picked them up for cephalometrics. Bigonial width, bizygomatic width,
という幅
and
を含め
intrapalatal width have also been used since the beginning.
こういう
Because they used porion, all growth anteriorly was measured was measured from the postglenoid process.
こういうふうに測ってました。
Now, 200 years ago,
200年前
in 1771, I redrew this from Hunter,
So Hunter is from 1771. で、これ
1771.
ハンターの
What he did was to show that there was a leeway space,
で彼が
that the width of the deciduous teeth
で
was greater than the premolar teeth.
Middle.
So by superimposing on infradentale,
そこで
he showed then that growth took place posteriorly,
彼が
and that the growth of the mandible then took place by apposition posteriorly and resorption anteriorly. This was generally accepted for 200 years.
でこの
It was reinforced in 1865 by a man by the name of Humphrey,
ハンプリ
who put some wires around the pig mandible.
で彼は
He found that the wires would be embedded posteriorly and loose anteriorly.
で
So Bryce came along in England in 1928
そして
and fed the root madder, which is like a beet.
ベジ
It's
タブル
like a beet, yeah, but it is a plant. And it contains alizarin red S. It's a dye. It's a plant that people use as a dye. And so he fed the madder to a pig
でこれを食べさせました。これ
for
株み
9
たいな
weeks.
野菜なんですけど、9週間これを食べさせて、
And then he stopped it for 3 weeks.
でその後
And he killed the pig,
で屠殺して
ate the pig.
豚を食べました。
And then all the new bone that was formed in that last 3 weeks was showing then, as I put up here in yellow.
それで
So with all this growth back here,
これだけ後ろの方で成長があります。
these seem to support what Hunter had said and what Humphrey had said.
でこれで
So people began to interpret the mandible as growing like this. Now along comes Broadbent, and he established then a machine which he could position the patient and take an x-ray from the front and from the side and study the growth of an individual patient. He used then Bolton's point because he couldn't find basion because he had it covered up
ここでは
with a lot of the mechanics of his head holder. So the first 5 years of my work was done with this cephalometer,
そこで
and I hated it because it covered up the joint. It even covered up basion in small children. Because he couldn't find basion, he went back to Bolton's point, which was behind the occipital condyle.
です。
So the first thing I did when I went to California was to change the ear rods to wood. So we can see now basion.
これで
We
ベ
can
ジオンが
see
見えます。
porion,
ポリオンも見えます。
internal acoustic meatus.
内耳道も見えます。
Look at the visibility of detail now in this area, which we had covered up. Right there's the zygomatic arch.
これが胸骨球。
Right here is the articular eminence.
これが
Right here's the condyle sitting in the fossa. This right here is AG point.
これが AG 点です。
Right here is the J point,
これが
jugal process point, right there. So
Jugal.
now this was his early exploratory,
これが what's an exploratory.
when he explored to find the points. And he came up then with these three. He used articulaire to Nathion. His cranial base was Bolton to Nasion.
それから
And his maxilla was ANS and PNS,
上顎
and point A.
から A 点を使っていました。
Now this is the only thing I still use.
私
I
が
put this heavy line on here, and I put
私
this one here
この太い線2本私が加えました。
to show how closely he had what we have come up with since. We have 1 month to 3 to 7 to 14 to adulthood. Now Brodie took his work
で、ブロディはこれを元に
and he focused then, instead of Bolton's point,
今度はボルトンポイントではなくて
Stella Nasion.
セラ
And he measured from Stella Nasion to Gonion Nathion.
セラナジ
He described the facial or the y-axis
え
from Sella to Nathion.
セラからナッシオンの線
And he called Nasion to Gonion his x-axis.
で、
He didn't measure soft tissue. In 1946,
1946年
Bjork picked up on Sella Nasion as well.
ビュル
He went down to articulaire, then to
それ
Gonion,
からこう
and to cephalometric Nathion, up to infradentale, from Procyon to the anterior nasal spine, and then back to Nasion again.
そして
Now this is where he started. He measured these angles. Now 2 years later, Downs came in with his analysis.
で2年
Here's an orthodontic case at 14 and a half years of age.
矯正治療
I saw this patient.
私自身この患者見ています。
He took four teeth out of this patient.
4本抜歯しましたこの
It
先
was a
生。
class 1 with a long face that he used for his illustration.
こうその例として彼はこ
Now
れを
what
使
he
ってい
did
たわ
was
けで
come
す。
back and focus back on Frankfurt plane again.
彼は
And he measured the facial or the y-axis from Frankfurt.
でワイヤ
He measured the mandibular plane.
で
He measured it like Broadbent had measured it, from subgonion to menton. He used pogonion and described point B. And his angle of convexity
それか
was
ら
the reflex angle. He measured the facial plane, facial angle.
フェイシャルアングルを
He measured teeth to the occlusal plane. He also measured the upper incisor to the APO plane, but did not measure the lower incisor to the APO plane.
で AP
So I happen to know Broadbent very well. Brodie was my teacher. I knew Bjork very well, and we spent many, many hours together. And I was a student of Downs. So I was in the middle of all of these developments.
で
Brodie tried to establish a coordinate.
ブロディ
And what he did was to use the cephalometric porion for his porion, using a template
その時にテンプレートを使いまし
in
た。
order to locate it, which is very inadequate. But then he dropped a perpendicular from our point,
で、
and later then moved forward to use the pterygomaxillary fissure.
で後で
Meanwhile, Bjork stuck with Selanasion. So Brodie was trying to move away from Selanasion a little bit, but Bjork stuck onto it.
それ
Now the unfortunate part was
ただ残念なことに
that here he said Selanasion was correct, and the thing that was wrong was the position of Basion. But it was very inviting to use this way because that's the center of a bullseye,
これがブルズアイ
like a target.
標的ちょうど標的の真ん中のようにいかにも見えますのでどうしてもこれを基準点に使いたくなっちゃうんです。
Now Brodie found when he used Sella that this was the circles that I told you about yesterday. And he found this orderliness here and this orderliness here.
で秩序
And then he tried to do it down here, which sees way off the lower border of the mandible here.
で
And on this basis then,
でこれに基づいて
he described what he called the constancy of the pattern. But then he began to find that there were not always growth down the y-axis.
ところ
Some patients open,
し
some patients
あ
close.
るいはこの軸が閉じてくる人もいます
And he tried to explain this as behavior in the glenoid fossa area.
そのようにはいけませ
This
んで
is
した
also from Brodie's findings, where a child had had a rheumatoid arthritis, and the mandible had not grown. Here's another one with rheumatoid arthritis, one of my patients.
の人
Notice
です
the 69.
この角度69度こちらは75度になっています
These are indeed growth arrests.
であり
Then
ま
I
す
assembled these extremes in a sample of the first 25 patients that we had with class 2. Now what do you see here? What's significant about these? If you notice, the cranial base is almost the same. If you notice, the plane of the palate is the same. The one has a chin all the way up here, and the other has a chin
ただ
back
違
here.
うのは音がずっと前方に出てるのが一つそれからもう一人後に引
The
いてい
major
ます
differences are in the mandible. And the mid-sagittal tomogram,
そこ
and found the base ion was sticking right out there at us. Very plainly evident.
はっきり
So, getting away from cell and getting away from the problem with the Frankfurt plane with the ear rod,
です
and not being able to find Bolton very well, I started experimenting with Bayesian. So I went to Bayesian Nasion
B
and superimposed patients on the crossing of the y-axis right here.
Y 軸と
And this is the method then that we developed early.
これなんで
In
す
order to connect the mandible
科
with the
学
cranial base,
とそれ
we drew a line up the long axis of the condyle.
there's a-
And from the lower border of the mandible that you see here, found that some patients were growing more
で
posteriorly
この線から
and others were growing more
あるいは
vertically. It was published in 1952. Now what we discovered as this was taking place
こういう
in
よう
the
な
samples that we had
ことをやってその
during the course of treatment was that when the mandible did open like this,
科学がこのように軸が開いたという場合
the chin was going down instead of forward.
その場合は
When the mandible was growing vertically,
科学が垂直方向に成長
the chin
し
was
ている
moving
場合
forward. Now, I think we've had a good day.
あの
This is hard work,
随分もう一生懸命やりました
but to me, orthodontics starts with a knowledge of anatomy. If you don't know your anatomy, how can you trace an x-ray? How can you find out for yourself what's going on? So we started out this morning with, what did we talk about this morning?
temporary
Huh? Temporal bone.
Yes, I said temporal bone. I
Temporal
said,
bone.
Yes,
Then we went to the mandible and the hyoid.
right.
And I tried to bring in the clinical significance of all of these parts that we're talking about. So we've talked about the growth of the cranial base, and now we're into the growth of the mandible. And we've carried it up to about 1950. In 1950, my first attempt
1950年ですごめんなさい
I made my first attempt at forecasting in 1950. Now tomorrow we will start out with the mid-face complex. The very first thing we will start with the intermediate bones, and then the maxilla
それから上
specifically,
それから
and
次
then we'll get back to the growth of this, finish this lecture. And then tomorrow I will also bring you right up to date to the work that I've been doing in the last 6 months. Long-term growth from childhood to maturity in 133 patients. Very fascinating.
これ大変興味深いデータがあります
What I'm trying to do is to still make illustrations when I get home at night, so you people don't know it, but I'm working every night. I've been working since 5 o'clock this morning,
朝も5時から今日の準備をしてきた
just to keep you informed.
まあ
So
そう
if
いう
I
こと
get
も
yawning a little bit, you'll know too.
で
Okay?
講義中
You're here to learn, and I'm here to teach.
皆さんはせっかくいらして勉強のために来られたわけですから